Good night, brothers and sisters. It's indeed a pleasure to be here to share this information with you. As we know, it's the one thing on everybody's mind right now, coronavirus. And everybody has some sort of anxiety. Is it true? Everybody is worried. We are hearing so many different stories. We are hearing so many different reports of people dying, of things happening, and we're just not sure. A lot of people just not sure. And this happens because it's really a new emerging virus, and it hasn't been studied before, so they are just learning as it go along what it can do and how things are happening, basically. So tonight, we thought it fit to present to the church this information because what we're trying to do is to get the word out as much as possible to educate persons and to prepare persons for what is possibly to come. We're trying to go into communities to spread the word, go into schools, because there's a lot of information to be given. But somewhere along the line, as you know, on the internet and so on, there are misinformation also. And a lot of people tend to listen to this misinformation, not knowing, because they're just searching. As I said, everybody is anxious, everybody is looking for answers. So tonight, I come to give you updated figures and correct information. We take our information from the World Health Organization, which is normally up to date, and they have a website. You can go to the website, the WHO website. It is usually uploaded daily, on a daily basis, and it will report all the cases, all the countries, and any up-to-date information you want to know on anything, you can go there and get it, right? Just to start, as I said, before I go any further, what we would do the presentation, and afterwards, if you have any questions, we can do a question and answer session, but we'll leave it for after the presentation, okay? Before I go into this slide, I just want to give you an update of the figures that is happening globally right now. Okay, so globally, we have 105,586 cases worldwide. In China, there are 80,859 cases and 3,100 deaths in all. Outside of China, that is the other countries of the world, there are 24,727,100 cases, and 484 deaths in all. In the Caribbean region, I'm just going to give you some of the cases that are occurring in the Caribbean region. As you see, it is getting closer and closer to us because it's already in the Caribbean region. It's in the Dominican Republic. They have 1 case reported. French Guiana, 5 cases. Martinique, there are 2 cases. St. Martin, there are 2 cases. And St. Bartholomew, there's 1 case. No deaths have been reported in these islands. In the USA, there are 213 cases, 11 deaths reported thus far. In Canada, there are 57 cases, 0 deaths as of the website today. And the United Kingdom, 210 cases with 1 death reported thus far. So we see, you can understand from the figures what is happening, right? It's pretty serious. It's a pretty serious situation, and we need to take heed. As we know as a church that we are living in the last days. A lot of persons may know. Some of them are denying it. Some of them just refuse to believe it. But we know and we expect, the Bible speaks of these things that would be coming. So we just need to educate ourselves and prepare as best as we can. So the coronavirus, as we're going to see from the video. We're going to see what it is. We're going to see what it can do. We're going to learn how we need to protect ourselves. And we're also going to see, give you some general information. I'm going to give you a video, a short video on what is coronavirus, basically some general information that you would need to know. So take a moment, just listen to the video and take what you can learn from it.
December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
So the second thing we're going to do is see another video on the use of the mask. So we gave an oversight of what coronavirus is, how is it transmitted, and basically general information that has been going around out there, what you need to know in terms of symptoms and so on.
Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick. However, if you are healthy, but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. And remember, if you choose to wear a mask, use it and discard it properly, and clean your hands with alcohol hand rub or soap and water. For more information on mask use, other preventive measures, and the new coronavirus, check WHO website at who.int. Thank you.
So basically, as we see, we've been seeing a lot of persons walking around with face masks, right? The mask, as we heard, it's not 100% guaranteed that it would stop you from contracting coronavirus. I must say that coronavirus is not only spread by droplets, as they said, as in somebody sneezes and coughs, and the little droplets that are in the air disperse, somebody else breathe them in, but those droplets, they fall eventually on surfaces, and you come and you touch the surfaces, or you put your phone there, or you pick up something and you put it to your face. That's how it's transmitted also, right? So we have to be very careful when using masks. The masks that are going around is a simple mask that you would buy in the store. It basically offers limited protection. What we recommend is what we call a S95 mask, N95 mask, sorry, and we use it in the hospital setting. But this mask is more expensive, but it filters more. And right now, I'm being honest, there's a shortage of masks everywhere. So what you would probably find is just a simple mask. So if you have to use it, you would use it. But it is not the ideal, and you must know that it is not what is going to protect you 100%. I'm just going to give you another idea of how to use a face mask in the case that you have to use it. How to put on, use, take off, and dispose of a face mask properly. Before putting on a mask, you need to clean your hands with alcohol-based hand rub or soap and water. We cannot stress it enough that you need to be washing your hands. Wash hands, wash hands, wash hands. That is what we are saying. You need to remember that. Soap and water. Before putting on a mask, you need to clean hands with alcohol-based soap and water, as we said. You need to cover the mouth and nose area with the mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap water. Replace the mask with a new one as soon as it is damp, and do not reuse single-use masks. That picture up there is the example of the single-use mask that we are speaking about. It gets, you're sweating, it gets sweaty, it gets soggy. You cannot be reusing it all the time. And one of the problems we have with the mask is that persons are using it, yes, but they are not recognizing that the contamination is outside of the mask. So you have the mask on, you're touching it constantly, and that is a source of contamination. So you see what we're dealing with. About hand washing. As I said, we cannot stress it enough. You have to wash your hands. The virus is it's a virus that dies easily. It is easily killed in sunlight. It doesn't live for long in sunlight, and you can kill it easily with disinfecting solutions, right? So to protect yourself and others from getting sick, you need to wash your hands after coughing or sneezing, when caring for sick persons, also before, during, and after you prepare food, before eating, after toilet use, and when hands are dirty, and after handling animals or animal waste. We have another video which is going to demonstrate to you the correct way to wash hands. There is a correct way to wash the hands. So you're going to see from the video what you need to do to wash your hands and what we are recommending that you do.
Stop the spread of viral infections, including the flu and COVID-19, by practicing proper hand washing. Follow these simple steps. Remove all jewelry before washing hands. Wet hands using running water. Place liquid soap in hand. Circulate using rotational movements, interlace fingers, and repeat switching hands. Wash back of fingers, rotating them in the palms. Wash fingertips, rotating them in palms. Wash thumbs using rotational movements. Thoroughly wash hands down to the wrists. Rinse hands. Dry with clean tissue. Turn off tap using tissue. Use tissue to open door and discard in bin. A simple act can make a huge difference. Stop the spread of viral infections, including the flu and COVID-19, by practicing proper hand washing. This is a message from the Ministry of Health, Wellness, and the Environment.
So, as you see from the video, it's not just a quick 2 seconds thing, you push your hand under the water and you go. Right? So I just wanted to highlight some things from the video. As you've seen, the different methods of washing your hands, you wash interlocking them, you wash the thumbs, you wash the palms, and all of that. And it's supposed to last between 20 to 40 seconds, guaranteeing that the germs are being killed, right? So you also notice that she has been using paper towel. We're recommending that you do not use towels that you have in your homes that everybody is using. It's recommended that you use paper towels, single use, and you discard. And it is also recommended, as you saw from the video, the lady, after washing her hands, she dried in a paper towel. She used that same paper towel to turn off the tap. And after using that, she used that same paper towel to open the door handle. And she dropped it in the bin and she left. So those are the practices that we are encouraging. It might seem silly, but when you think of it, imagine a door handle. Door handles, phones, doorknobs, that sort of thing, they're full of germs. Everybody touches them. So you have to find ways of protecting yourself. So you need to pay attention to these little details. They are very important. Concerning when coughing or sneezing, as was mentioned before, to prevent the spread of flu and coronavirus, you need to cough and sneeze into your elbow, not in your hands. This is what we are recommending. Achoo. You sneeze and you cough into your elbows. That is to keep your hands free and free of germs and because you come in and people imagine, I come at you, I come and I shake your hand. You would not appreciate that. And that's what happens. It's reality. And the other thing is, we are getting to a stage where we are also advising against shaking of hands. So we are saying, we are practicing good habits. We need to start now. So instead of shaking hands, we knock elbows. Right? Yes. Because shaking of hands is personal contact, and you're just spreading the virus. So as we said, this is an informative, interactive session so that you can learn and be informed. There's no sense in us keeping the information and not sharing it, because everybody needs to know. This disease does not discriminate from anybody. So we're moving on. The use of hand sanitizers, this is being encouraged. However, we are encouraging the use of hand sanitizers in the place where you cannot wash with soap and water. Remember, the first thing we are encouraging is wash hands, wash hands, wash hands. So, in the case where you may not be able to go to the pipe to wash your hand with soap and water, or in between those frequencies, we are advising that you keep a bottle of hand sanitizer. It's preferred that it be 70% and above, and after every use, as frequent as you can, you put some on your hand, and it's sufficient to kill the germs on your hands. But as soon as you can get to soap and water, it's recommended that you wash hands, wash hands, wash hands. I'm going to go into another area. I'm going to explain to you what is quarantine and what is isolation. I'm sure that since this whole coronavirus event started, you've heard that we have had persons in quarantine, and some persons might not have been clear what they're actually doing and all of that. So this is the difference. Quarantine, I'm going to start with quarantine. Quarantine is for well people who may have been exposed to a communicable disease. Listen carefully to the difference. It applies to people who may or may not become sick. It restricts the movement of healthy people who may develop a disease after possible exposure to an infectious agent. It requires people to stay in a designated location, example, their homes, for a specified period of time. It requires active monitoring, including taking of temperature twice daily and checking for other symptoms. PPE, not required for contact with people who are not ill. PPE refers to personal protective equipment. When we say personal protective equipment, we talk about that hazmat suit, that gown that you see everybody wearing in China now, the whole gown and mask and everything, that is what we call PPE. So isolation. Isolation is for people who are sick. It's, you separate people who are sick from those who are not sick. That's what you do in isolation. It restricts the movement of people with an infectious disease to stop the spread of the illness. It allows for appropriate treatment in a hospital-type setting. It requires appropriate personal protective equipment, or PPE, for those coming into contact with persons who are sick. So in isolation, you have to wear the PPE, those attending to the sick. It requires proper infection control, sterilization, and waste management. So what has been happening so far in all the world, all over, we've been having a lot of persons traveling. Now, you know, traveling, that has been one of the major issues, because an hour ago somebody was here, next 2 hours they're in another country, next 3 hours they're there, tomorrow they're in another country, and that has been the major issue. So we have, as other countries, we have countries on a quarantine list. For example, China, if you're coming from China, we would say that once you come in, we would quarantine you for 14 days. Now, the 14 days came about because that's the period of the incubation period that has been found to occur in this virus, right? Between 2 to 14 days. So we go to the maximum, which is 14 days. So we are quarantining. You're coming from China, you're not sick, you're not showing signs and symptoms, but you're coming from an area where the virus is being transmitted locally, meaning that people are getting it. They're contracting this virus in the country. So we need to monitor you. So what we do when you come in, you go into what we call quarantine. Right now, we're doing quarantine in homes. So a room in your home, you have to stay there, preferably a room that has a bathroom and everything. You have to stay there for 14 days. You're not allowed to leave. You're not allowed to mingle with anybody. And what happened, the public health nurse goes to your home. They would go twice a day with the thermometers. They would measure your temperature, ask you how you're doing, find out if any symptoms, new symptoms have occurred, what's happening with you. And basically, we record this. If during that quarantine period, you start coming down with a fever, symptoms, or something similar that would indicate that you're now presented with coronavirus, we have to isolate you. So you're now going to be transferred to an isolation facility, and you would have your test done. As we would see from the other slides, you would have your test done, but you have to be isolated. In the case where you've completed your 14 days and you haven't presented with any fever, cough, shortness of breath, anything, you are free. We release you from the quarantine, and it has proven to be quite safe. There has been some cases reported in China that it has extended past the 14 days, the incubation period. It has even been suggested 24 days, but it's not the norm that they are seeing. Most of the cases are within 14 days they present. So everybody clear on isolation and quarantine for now? So persons who have been in contact with coronavirus patients, or who show signs of coronavirus, or who have a positive travel history to countries where there are local transmission of cases, will be tested. There's a test that we do. Currently, we have the capacity in country to do the test. We don't have the machine here, but there's a protocol in place where the tests go off to CARFA in Trinidad. We are not the only Caribbean island that do that. I think Barbados are doing their own testing, but the other Caribbean islands, they all have to send them to CARFA, which is the Caribbean Public Health Public Lab, right? So we send them to CARFA, we get the results in 4 to 6 hours. So right now, that's what we have been doing if we have suspected cases and you have to send off samples. So it's not that we are not able to test for them. We might not have the machine in country to do it, but there is a mechanism of getting the test done. So that's what's happening. So patients with a positive test result will be admitted to an isolation facility for treatment. And that happens in severe and moderate cases. In mild cases, they may be required to self-isolate in their homes with a dedicated caregiver. Now, why I say this? We all know that we are a small island, resources are scarce. A hospital cannot hold everybody. We talk in facts. So, as it stands right now, we are hoping to isolate the severe and the most moderate cases, and those mild cases, they would have to self-isolate in their homes. And normally when you isolate in a home, somebody would have to be a designated caregiver. Equally when you quarantined. So it's a give and take situation. As you see, it's not a nice situation, because even if you're being quarantined and just monitored for signs and symptoms, there's somebody that you have to assign, one person who's going to bring your food, one person who's going to take your dirty clothes and wash them, to limit the contact from the other family members. So imagine if you have a sick patient now, they're going to have to be a designated caregiver, and this caregiver would have to know exactly what they have to do and how to protect themselves also. So it's really a frustrating thing. It's not a nice thing. Well, so who is going to take care of you? Because your neighbor might have a sick there too in their house, and the other neighbor, and everybody have to pull their load. So, as we say, it's something that I understand what you're saying, but you have to look at it that if push comes to shove, it has to be done. But that's what I'm saying. We are anxious. So this is why we are giving you knowledge, the information before, so you can go ahead and prepare. Because what we are doing now is telling people you need to prepare your household. You need to identify somewhere, whether it's a room, a downstairs, or somewhere that you can have a plan. Every home have an individual plan, because we don't know what is going to happen. But I'm saying in the extreme cases where we out of control, that would not be happening. So everybody would have to take care. It is reality. We're talking, look at what's happening in China. It is the reality. So we're not going to sugarcoat anything and tell people, oh, you get sick, everybody going to come to the hospital. Because it's not possible. So we are sensitizing you that there may come a point where you would have to take care of someone who is sick in your home. Right? So we're going to move on. Who is at risk? Everyone. The old, the young, the not so young, the sick, the healthy, the rich, the poor. Isn't that true? So we just have to prepare. Who does it affect more? Because what they have found from studies in China so far, from the cases they have done studies about different age groups and different persons and so on, and I'm going to give you some facts about what they found. It affects the elderly most. It affects patients with heart disease the most. It affects the immunocompromised. When I say immunocompromised, I mean patients with HIV, cancer patients, patients whose immune level are low. And unfortunately, it has been shown to affect males twice as much as females. However, it is quite interesting that children, it is, as they say, sparing children. It's not that children are not being infected, but children are not presenting with the severity that you're seeing presented, especially in the older folks. So especially children from 0 to 9, they have done the best. There have been even 2 babies that were born to mothers that were positive, and the babies are strong and well. So for some reason, it's not really affecting children. How to reduce your risk of coronavirus infections? It may seem simple, but it's the same message we have over and over. To clean your hands with soap and water or alcohol-based hand rub, that is hand sanitizer. Cover your nose and mouth when coughing and sneezing with tissue or flex elbow. Avoid close contact with anyone with cold or flu-like symptoms. Thoroughly cook meat and eggs. Avoid unprotected contact with live, wild, or farm animals. And this is from the World Health Organization. What must you do if you suspect a coronavirus infection? If you have a pen and a paper, I would like you to write down the numbers. Because right now, this is what we're telling persons. If you find that you have symptoms and you have been in contact, or you think you may have been in contact with someone with coronavirus, you need to stay home and call. We are desisting from everybody trying to rush into the emergency room because you're going to contaminate everybody. As we say, you call one of these numbers, whichever is closest to you. I'm going to leave this slide up for a while so you can write your numbers. You call and identify yourself, you let the nurse know what's happening, why you're calling, that you might suspect that you have coronavirus disease or your symptoms, or you just came off a flight and you think somebody who you were next to have it, anything like that. You call and the public health personnel will come to your home. They will decide if you need to be quarantined and they will do the necessary checks. So we have the Stubbs Polyclinic, which is 458-0743, Bookament Bay Polyclinic, 458-7191, the Levi Latham Health Center, 458-5245, Port Elizabeth Hospital, 458-3294, the Georgetown Health Center, 458-6652, Union Island Hospital, 458-8339, and the Milton Cater Memorial Hospital, 456-1955. It is very important because we need to contain the infection. So if everybody starts flocking at the clinics, everything is going to shut down. Because remember, there are other vulnerable patients that are at the clinics and at the accident and emergency. So we are trying to, as we said, quarantine and isolate to avoid the spread or the transmission of the disease. Coronavirus is a serious threat, and we have to be prepared. We don't know what is going to happen. We are not sure. We are just waiting to see day by day, and we just have to be prepared, as I said, and you can only do that by arming yourself with as much knowledge as you can. As I am encouraging you, I know nobody wants the task of taking care of an ill person, but put yourself in that shoe. If you were the one that was ill, would you like your family to abandon you? I mean, we are all scared, yes. It's the reality. So we need to have a plan in place. Every household needs to start having a plan in place. And everybody finished with the numbers? I can put it back up at the end. I'll put it back up at the end. Let's just finish this slide and I'll put it back up while we do the question segment. Right? So, there are some other recommendations. As we say, we are encouraging households to start preparing. You need to keep a supply of hand sanitizers. You need to keep a supply of food and water in case of being quarantined at home. You should avoid shaking hands by touching elbows instead, as we mentioned. Avoid mass gatherings as much as possible. This is a recommendation that we have started putting out. It may seem like it's inevitable, but if the session we have done, it can go on, it can go on. It is for our protection. So we have to understand why we are doing these things and why we are recommending it. Because in a mass gathering, such as we are in a church also, everybody is sitting close to each other. Everybody is hugging. Everybody is greeting one another. Everybody is singing. When you sing, what happens? Okay. So you see why we are encouraging not to be in mass gatherings. We are encouraging you to disinfect your surfaces frequently. Your tables, your floors, your workstation, you have to keep disinfecting. And it is recommended that you can use a solution of Clorox, 5 parts to 1. So you're going to use 1 cup of Clorox and 5 cups of water. Dilute it with that, and that is good enough to do the disinfecting. You can also use the rubbing alcohol, the Lysol, the Dettol may be used also to disinfect. So I don't know if you have noticed, but if you go to town tomorrow, the pharmacies are almost out of rubbing alcohol, Lysol, Dettol. Clorox is almost off the shelf. Hand sanitizers have gone. So we are encouraging you. There are some places that still have limited supply. So if you need to move soon to get your supplies. It's a very serious situation. It's unfortunate, but as we say, it may sound like bad news, but it's equipping you and preparing you. So be prepared, spread the word, take back what you've learned tonight to your neighbors, to your co-workers, to your other family members. Let them know, and we just need to be prepared, as I said. Thank you very much. So money is a serious issue. We know how that is. So that's why we are recommending hand washing and hand sanitizers. Right. So you would try to walk with your hand sanitizer. If you can't get your hand sanitizer, I suggest you walk with some rubbing alcohol and you throw that on your hands after you finish dealing with that money, and you sanitize your hands, or the Lysol or Dettol or something. Because the money has been a serious issue. Yes, they have been going to the schools, they have been educating, the schools have been speaking to the children, but as the plan is, if it comes down to the virus being present in the island and we have to suspend schools, it would be suspended. Because we know children how they are. And they, as we said, from the data that has been coming out, they get ill, but they haven't been dying or presenting in severe cases as the adults. But we have to protect the children too. So school would definitely have to be suspended. And we are also encouraging children, parents to give their kids hand sanitizers and encourage them in the proper hand washing method. And I think the schools already have initiative where they're trying to source hand sanitizers to give to the children. So I know it's an area of concern. There is an updated list of countries where we are quarantining persons who come from that country, and I think China and some other countries. This list is updated more or less on a weekly basis. And China, I know, definitely is on the list. We are not taking anybody from China or Italy. They are not allowed to come in. However, if it's a national, like we may have students studying in China, we can't stop them from coming home. So if they come home, then we have to quarantine them. But other persons who are not non-nationals and coming from China or other places like Italy and so, they are not allowed into the country. The tourist boat has been a serious issue. As of now, there has not been any ban on the tourist ships coming in. But as I said, the list that has the countries, it applies to the tourist ship. So example, might have a tourist ship coming from Italy, so you would tell them ahead that they are not allowed to come. If they come, if they still decide to come, they would not be allowed to disembark. So basically that's how it is being managed right now. Yes. What we advise actually, if you suspect that somebody have the symptoms, signs and symptoms, you have to turn off the air condition immediately. Because even in our setting, if a patient enters into our setting and we suspect, it is recommended that we turn off the air condition and we go into the isolation mode of things. If you are at risk diving into the mucus in the sea, I am really not sure, because that would have been in salt water. I am not sure of the effect of salt water on the virus. As we said, it's a new virus. It is just being studied. So that part I'm definitely not sure of. But as soon as we get some information on that, we'll be able to pass it along to you. For your precaution, and we have been telling people to desist from traveling if it's non-essential. I mean, I know it might be difficult because you might have already bought your tickets and all of that, but you have to wait. You have to wear it, yeah. Because these countries have transmission, what we call local transmission, meaning that somebody is spreading the disease locally. The disease is being spread locally. And we don't know. If you may go, you may come into contact, as well as you may go, enjoy yourself, come back home, and nothing happen. But the list, it has not been, once it's not on our list, because as I said, we try to update the list on a weekly basis, and that's how it is. It's just the same. America has cases, but they are not on the quarantine list. And take precaution. You be aware of your surroundings. You go somewhere, a bus station, or you go to eat and you see somebody coughing non-stop, sneezing, whatever. You have to be aware of your surroundings too. And you distance yourself. So really and truly, they're desisting from non-essential travel. Because you know, the whole mix-up in the airport too. When you're in the airport waiting in transit, you don't know who is passing you with what. Yeah, everything, all of that. So we're not saying no. So we don't know. Because look at what happened with the other tourist ship, how many cases they tested positive. And so we don't know. Nobody knows where it is. So you just have to be aware a lot and try and protect yourself as much as you can. But being realistic, we touch our face and all over our body, and sometimes we're not aware of it. We're being realistic. So it's not that you know that your hand's dirty and you only go and touch it. We're being realistic. So we can't pretend we live in a bubble. No, we're being realistic because this is what happens. And not only that, how many of us have phones? Exactly. Everybody have a phone. How many persons just put down the phone? Everybody they have a phone in your hand. You're touching your phone. You pick up something. You go to the bathroom. You're even carrying your phone there. You go on your bed. You rest your phone on your bed. So think about it. So you have to disinfect your phone too. No, you use a bit of rubbing alcohol and you clean the phone. But that is just a source of spreading the infection. It's just to make you aware. The simple landline and doorknobs and these things. Because there has also been concern and they are looking at why it hasn't already spread rapidly in Africa. They were asking that question. They were expecting that because Africa is so poor and their healthcare system is so bad. We haven't seen an explosion of cases in Africa as we are seeing in the other parts of the world. And as we said, we don't have the answers, so they're still watching. Right now, there are only 3 countries in Africa that have reported cases. I think two of them have 1 case and 1 has 2 cases. But that has been a query. Why? We don't know if it's going to explode later, but as we see, as I give you the numbers in America, China, all over the place has so many amount of cases, but they are wondering. So so far, we haven't heard any statistics in terms of race. So we don't know in terms of race. Because remember in China, there's more of the Asians that have come down with it. So we have no statistics but they're watching that. So they're saying hopefully maybe the black man is immune to it. So we will continue to pray. Yes, we have in Ireland PPE, but as we said, everything is limited. It is estimated that to care for 1 patient in an isolation facility, it may take 20 PPEs for 1 patient. And why I say 20, because remember, the nurse has to change. Every time you go out, you have to change that. To go back in, you have to put on a fresh one, so it's not something that you have to be walking up and down in because of the transmission. So that is what it is. So it's very expensive. As we said, worldwide, everybody is scrambling for stuff, so things are scarce. And not only that, the few that people have, they have jacked up the prices in everything. The hand sanitizers, the gloves, the face masks, the PPEs, the prices are gone up. Yeah. It's a frightening situation because everybody is encountering it for the first time. But as I said, best you can do is just arm yourself with knowledge and prepare. Prepare your household, prepare yourself. You have to stock up on food. It's symptomatic treatment. So as we say, your symptoms are going to be like flu-like symptoms. You're going to have headache, cough, flu-like symptoms. So it's basically paracetamol, rehydrate yourself, keep yourself rehydrated. You can cough drops and so on, cough mixture. It is recommended that, remember, in the severe case, if you're home and you notice you start getting severe, that's why the very first video said, if you experiencing difficulty breathing and symptoms, you know you're not well, then you contact it and you would then be isolated because you would then be a severe case. Remember I said we would isolate severe and moderate cases. So in that term, you would have to go on even mechanical ventilation, where we have to hook you up to a machine to help you to breathe. That is what happens. The thing is, the virus, it destroys the lungs. So that's why the pneumonia comes in, and it actually destroys the lungs. So you have difficulty breathing, shortness of breath, and it leads to death. And the destruction in the lung comes mostly from the antibodies. What happened, the body produce like a rapid attack, a vicious attack against the virus. So in doing that, it not only destroys unhealthy cells, which are the viral cells, it also destroys the normal tissues. So it basically punches holes in the lungs. So you find your lungs filling up with fluid, you can't breathe, difficulty breathing, and then not only that, it not only localizing the lung, it attacks the kidney, the other organs, and you come down with what we call multi-organ failure and death. So that is what happens with the... If what? The kidney is shut down. Once they go into failure, they shut down and the body cannot survive. Yeah, so it's a pretty serious disease. So, well, I hope that the presentation have been very enlightening and informative. And as I said, don't just keep the information to yourself. Take it back to your families. Oh, I said I would put back the numbers for who didn't get to finish up writing down the numbers. And as we said, if you have any doubts, you can call your nearest healthcare facility. And really glad to have been able to share this information with you. And any way I can be of further assistance, we'll be grateful. Okay. Thank you very much.